Hi, my name's Amanda Wood. I've been a behaviour support practitioner for over 25 years. I'm committed to ensuring that people with disabilities are receiving ethical, person-centred and quality behaviour support. One of the things I wanted to talk about today is the communication and routine sections that are very commonly in behaviour support plans. And they're there for a really good reason. When you look at the theory and the evidence-based behind positive behaviour support that is, we know that often gaps in a person's lifestyle will lead to gaps and issues in their behaviours. So one of those big areas is their ability to communicate and their routine, their interactions in the community and the things that we do in life. And that's no different for anybody. If you're frustrated around your ability to communicate or understand people or for them to understand you, your frustration will often lead to irritability and behaviours, and it's no different for a person with a disability. So these communication and routine sections are in most behaviour support plans, and that's a good thing. However, what's in those sections should really be about the person. There will be, across some people, some strategies that are very similar because sometimes people's communication needs are similar. However, not always. And those strategies in those sections, for me, they should be very specific. They should give detail. I really love to see quotation marks. So when I'm writing a communication section, I'm outlining exactly what I'd like to be in it and exactly what I want people to be saying to help the person understand. So looking at those sections, I often see some red flags and I want to raise some of those with you. Please know, I am not saying that every time you see these following strategies I'm about to mention that then they shouldn't be there and that they're wrong and they're not good quality, because that's not always the case. These are actually really solid, effective strategies that have worked and will continue to work for some people. The problem is, I know that I'm seeing them when I'm looking at behaviour plans, when I sit on panels and a variety of other places where I come into contact with other people's behaviour support plans, that I'm seeing these strategies when they're not based on good clinical assessment. That means the needs these strategies are meant to be meeting are not the needs of this person, or they don't match the person's communication ability. So not everybody needs to have their name said before you talk to them. That's a really good strategy for people with maybe ADHD or who are very easily distracted, but it's not necessarily needed for everybody. Not everyone needs visuals and pictorials. Some people need photographs. Some people need real objects, and some people you can use language and verbalizations with. So I'm seeing a lot of first and then boards and yes and no boards, which again can be really effective strategies for people who can understand those pictorials, understand the concept of one thing coming after another, but not all of our clients that we work with in behaviour support can understand that, and some of them don't need those kind of strategies. So those things are things that I'm really looking into when they're in a behaviour plan. Does this meet the needs of this person? Not everybody can be communicated with using long sentences. And if I'm putting in a communication section that don't use long sentences with a client, I'm actually outlining what you should use and giving really clear examples that are related to examples that I would be using with that person. So a typical scenario with that person where I may want to give instructions or ask them to do something, I'm going to use that example that's about that specific person. The communication and routine sections shouldn't just be a list of things that you need to go away and develop. So develop a pictorial board that outlines weekly and daily timetables and includes things that the person likes and gives them choice. My behaviour support plan is actually going to do that. It's going to show you the weekly and daily routine. Funding permitting, I'm actually going to go away and develop the laminated pictures for you. If they're pictures, or they might be photographs, or they might be gestures. So it's really about getting down to those specifics about what the person needs. The routine section, routines can be really important in helping people understand what to expect and filling gaps in their lives. Not everyone needs a pictorial routine. Not everyone can understand a pictorial routine. Some people may need one picture. Other people may be able to understand if you put 10 pictures in front of them. I guess one thing that all of this flags as well is a lot of the things I'm talking about here as a behaviour support practitioner very much fall into the expertise of a speech pathologist. So a good communication assessment is something that your behaviour support practitioner should be asking for or advocating for. We don't always get it. There are funding constraints and restrictions, as we all know. And if we can't get access to a good communication assessment, we are going to make those decisions, but we're going to be talking to the person and the person around them to really get into understanding what their needs are in the absence of a good communication assessment. So look out in your communication and routine sections. Strong part of a good behaviour support plan. Make sure that the communication, the way it's outlined that the person needs to be communicated with, is used right throughout the plan. Another common thing that I see is a plan says don't use more than 2 words and use gestures with the person. I get to the reactive strategies, what to do when the behaviour is occurring, and the reactive strategy says something like, Amanda, don't do that. That's inappropriate. You shouldn't be doing that. When I've just read further up that Amanda doesn't really understand those long sentences and we need to use gestures and short sentences, maybe even 1 or 2 words. So the whole thing needs to match, otherwise it's not going to be effective. So they're my opinions on good communication and routine sections. There's a lot more to talk about in those areas, but just some key things to look out for. Thanks.